Hello, my name is Eric Crosbie, and I'm an associate professor here in the School of Public Health at the University of Nevada, Reno. Recently, we conducted a study measuring the air quality in smoking and non-smoking areas of casinos in Reno and Sparks, Nevada, to understand the potential exposure to tobacco smoke both for employees and patrons that frequent these establishments. Now, I know what you're thinking when you think of a casino. You probably think of the slot machines, the flashing lights, the excitement of winning big, the triple sevens. Yet casinos are not just about gambling anymore. Many of them today have something for the whole family to enjoy, including delicious restaurants, relaxing spas, and fun activities for kids, including arcades, bowling alleys, and yes, even ice skating. However, several casinos still allow smoking on their properties, which is shocking when you consider how we have banned smoking in most public places, including airplanes, hospitals, and more recently, restaurants and bars. The reality is that tobacco use is still the leading preventable cause of death worldwide and in the United States, killing more than 480,000 Americans each year, in which more than 41,000 of these deaths are caused by secondhand smoke. So, what's the solution? Well, tobacco companies and some casino owners would tell you that ventilation systems could solve this. However, there's already sufficient evidence to date that these ventilation systems do not work and that there is no safe level of secondhand smoke. However, given that casinos have become more family friendly, we wanted to determine if minors are put at risk for secondhand smoke. Thus, we visited 14 casinos in the Reno Sparks area using the Apno Tube Pro, which is a portable air monitor, to measure the air quality within 10-minute intervals in outdoor locations, gaming areas, and non gaming areas. We also counted the number of smokers, minors, and total patrons in each location with handheld clickers. For this study, we measured particulate matter, or what is considered PM 2.5, which is a type of air pollutant found in cigarette smoke. And here is an index of air quality to further understand what this actually means practically. As you can see here, the higher the amount of particulate matter in the air, the more unhealthy the environment can be. Overall, all results revealed that indoor locations had medium particulate matter levels up to 18 times higher than the lowest outdoor background control levels. In particular, you can see here that in some casinos, these levels reach levels that are unhealthy for sensitive groups, such as those that have asthma, as well as even levels that are unhealthy for all of us. When comparing gaming versus non-gaming areas, overall, we found lower levels of particulate matter in non-gaming areas than gaming areas as expected. However, in some cases, these levels were higher in non-gaming areas, as shown in this casino that had unhealthy air for sensitive groups in gaming areas, but higher unhealthy air in non-gaming areas. Furthermore, no matter how big or how small or new or old the casino was, we observed high levels of particulate matter in all areas, indicating that new sophisticated ventilation systems do not work. When counting the patrons that frequent these casinos, we observed very small portions of smokers in each location, often less than 7%. As a result, a small proportion of active smokers can still contribute to high levels of particulate matter and contaminate non-smoking areas. This graph further illustrates this by showing how very few smokers were observed, as indicated in blue. Meanwhile, on average, there were many more minors frequenting these casinos, as indicated in orange. In conclusion, particulate matter in secondhand smoke can be high regardless of ventilation systems and with few or no smokers. Minors and workers can be exposed to elevated particulate matter in non-gaming areas, which is a key finding in this study. Thus, it is important to establish 100% smoke-free casinos, which is really the only way to truly protect workers and patrons visiting these establishments. We published our study here, which you can find using the QR code. And if you have any further questions, my contact information is here as well. Thank you for listening.